Welcome everyone to Nukui's Charting Your Course, Navigating Funding Streams to Support Your Health Programs, Series Session 2, titled Applying Indigenous Data Collection and Evaluations to Increase Behavioral Health Funding. Before we get started, I just would like to kindly ask everyone to place your name, organization, tribal affiliation, and title into the chat box. And we'll give it another minute or so as people come in. Welcome everyone, and thank you for joining Nukui's Charting Your Course, Navigating Funding Streams to Support Your Health Program, Series Session 2, titled Applying Indigenous Data Collection and Evaluations to Increase Behavioral Health Funding. My name is Sabu Kuyumjian, and I am the Public Health Associate at the Technical Assistance and Research Center for Nukui, the National Council of Urban Indian Health. Joining me from Nukui's team are Divya Nanduri, Fellow Public Health Associate, Mark Clark, Senior Program Manager, and Noel Zolke from our communications team. We are honored to have you all here today. As I mentioned before, we kindly ask that you place your name, your organization, tribal affiliation, and title into the chat box as we get started. Next slide, please. In addition, I want to remind everyone to please take today's post-community learning satisfaction survey that you will see right now in your chat box, but also at the end of today's session. Your feedback is very important to us and how we can better improve our webinars and community learnings for you and for your urban Indian programs. We also have a QR code if you'd like to scan and use that as an alternative option instead of clicking on the link. Next slide, please. Here's a look at today's session agenda. We will end promptly at 3 p.m. In today's session, I will provide a brief background on Nukui, go over some housekeeping items, provide guidance on how to ask questions, and engage using your emoji options in your Zoom chat. I will also share some upcoming Nukui events and introduce our co-presenters, Dr. Jamie Barges and Dr. Candice Flemings, to start our session. At the end of today's session, we will reshare the satisfaction survey and our upcoming events that you're seeing now currently if you'd like to register for our upcoming events. So next slide, please. For those of you that are unfamiliar with Nukui, here's a little background. The National Council of Urban Indian Health, also known as Nukui, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indian and Alaska Natives living in urban areas. Nukui is the only national representative of 41 Title V urban Indian organizations under the Indian Health Service in the Indian Health Service Improvement Act. Nukui strives to improve the health of over 70% of American Indian and Alaska Native populations living in urban areas, supported by quality, accessible health centers. Next slide, please. As we dive into our session today, here's a few things to keep in mind. The webinar is being recorded. Your mics are muted, but feel free to unmute them if you'd like to share anything. And you could type your questions also in the comment in the chat box. Emoji-based feedback today will be utilized for participation, and instructions on that will be provided very shortly. There is a very small session activity after the presentation and a Q&A. Next slide, please. To ask a question, first select chat at the bottom of your Zoom screen, then type your question or comment into the chat box that will appear on the right of your screen. Next slide, please. Here's a few instructions for the interactive participation during the session using emojis. So to use emojis, to respond, first open the chat box, make sure your chat box settings read everyone and open the smiley face to select your emoji. If you have any trouble with accessing any of these features, please message our Nikui staff present in the chat and we will assist you promptly. Next slide, please. And just wanted to share some upcoming events that will be happening. So our part 3, session 3 of our Charting Your Course, Navigating Funding Streams to Support Your Health Program series is happening on November 16th. And the topic focus will be Cedar Branch, Strategic Planning for Community Advisory Boards. And our the next day, actually Wednesday, November 17th, there is another community learning session for a different series on messengers in health, titled "'Tis the Season to Vaccinate," that will focus on flu, pneumonia, and COVID-19. So both of those options are, the registrations are in the chat box now if you'd like to register or for later. Next slide, please. And now I want to welcome our presenters, Dr. Jamie Barges and Dr. Candace Flemings. Dr. Barges serves as the President and Chief Executive Officer of One Fire Associates. She is an enrolled citizen of the Cherokee Nation in Oklahoma and has spent her career working both in tribal and urban American Indian communities across the U.S. Dr. Barges previously served as an assistant professor of research at the University of Oklahoma Health Science Center within the Indian Country Child Trauma Center. She has also worked at the national level in her previous role as the Director of Technical Assistance and Research at Nikui. Dr. Barges completed her PhD in clinical psychology at Oklahoma State University and did her internship at the University of Florida Mental Health Institute. Our next presenter today is Dr. Candace Flemings. Dr. Flemings is Kickapoo, Oneida, and Cherokee, and was raised on the Northern Cheyenne Reservation in southeastern Montana. Dr. Fleming currently serves as the Senior Research Director with One Fire Associates and is responsible for providing highly technical training and consultation to One Fire Associates staff and to communities served. Her degree in clinical psychology was confirmed in 1979 by the University of North Carolina at Chapel Hill, and she has 40 years of experience in training, administration, research, and evaluation. Dr. Fleming has developed expertise in program evaluations for both treatment and prevention efforts with Indigenous populations, as served as much as her career at the National Center for American Indian and Alaska Native Mental Health Research at the University of Colorado. Dr. Flemings resides in Maine with her family now, and we want to please welcome both Dr. Barges and Dr. Flemings with some heart emojis and some heart reactions in the chat box as they start their presentation. Dr. Barges, the mic is all yours.
Thank you very much. Thank you, Sabu. Thank you to the Nikui staff. CEO Jija Lagi. I'm enrolled in the Cherokee Nation in Oklahoma, and I'm happy to be here and thankful that you all are here with us today. And I'm very happy to be also co-presenting with Dr. Fleming. She's been a mentor of mine for a long time, so I'm happy that she's joined us at One Fire to support our team and the communities that we serve. So I'm just really blessed to be here co-presenting with her as well. So we're going to be speaking today about identifying, organizing, collecting data that will help support your behavioral health programming, and of course also the grant funding, which those things tend to go hand in hand there. And so we understand that some of this that we're presenting will also be good for your tracking of the work that you are doing as well. And so I just want to open up today, if you could go to the next slide, just by giving a land acknowledgement about where we are. So One Fire Associates, we are a Cherokee Nation TARO business, Tribal Rights Employment Office business, located in the Osage Nation. So I just want to also honor the Osage Nation as well, the land where we're at, where our organization is located. We do work with tribes and urban Indian health organizations across the country from north, south, east, and west. And so Dr. Fleming is actually at another location, as well as most of our staff are working in different states. So we're I'm very excited that we're able to be here today to support you all in your efforts. Next slide, please. Just a little bit, I want to share with you a little bit about One Fire. You can go onto our website. It's at www.onefireassociates.org, and you can learn more about the history of the name One Fire. But it does come from my tribe. We have a story about the importance of the one fire that keeps us all together, and we really work to support quality and culturally grounded evaluation, research, and capacity building for communities. So we have a motto, nothing about us without us. And so we always work directly with youth and families as a part of the team to build research and evaluation capacity. We do use a community-based participatory research model primarily. And so we really want to engage communities in growing and owning their own data. So really happy to be able to continue this work. We find it very meaningful. Next slide, please. So today we're going to talk, we've got 4 learning objectives that we're going to work to cover today with you all. The first is to begin identifying culturally relevant data. This can be quite difficult sometimes, and so we want to talk a little bit about some things that we have learned and some things that we find to be very useful in many ways for local, culturally relevant local data. We're also going to talk about secondary data sources. A lot of times there's a lot we can find that's already out there that exists that we could use, particularly for proposals, as well as for tracking what's happening in your community. There are some secondary sources that we can use. And then we also will talk a little bit about primary data. This is the data that you all could gather in your own local clinics, in your own local programs. And so we'll kind of summarize some of that and then talk a little bit about some strategies for organizing data proposals. This is an hour session, so we're not going to go incredibly deep into all the topics, but hopefully we'll be able to generate some relevant resources for you all, and that we can share those resources with you also at the end when the presentation is over. Next slide, please. So just to get started here, we're going to use the fun emojis that Sabu showed you how to use. So if you guys can get your chat up, this is to help us get to know each other a little bit. And you can see the different emojis that have been selected for each of the different clinic types. So if you could look at the emojis and pick which clinic type is most consistent from where we're working and where you're located. So the sandia, the watermelon, is full ambulatory. The lemon is limited ambulatory. The strawberry is a residential treatment center. The orange is outreach and referral. I see some of that coming in there from Baltimore. And also the grapes, that would be another. Oh, we got some grapes too. So people are coming from different places. That's very exciting. Others. We've got people in others. For those of you in others, oh, thank you. Integrated healthcare outpatient. Okay, excellent. Next slide, please. And then here's another little exercise, and please, everyone's coming at different places, so don't worry about where you're at, but we do want to get an idea about where people are coming from. And in terms of utilizing local data to apply for behavioral health grant funding, how much skill do you feel like you currently have with that? So the swords are, you're a Jedi master and you really got it down. That's the swords, Jedi master. The big muscle, it means you're competent at it. You feel pretty competent at it. The chicken is that you're just beginning, like the little chick there. And is that a suitcase? A briefcase? Oh yeah, a briefcase. That means maybe you're a newbie and we're getting to work here. So we've got some ducks, very good. And we got some muscles out there, some competence. Anybody else? Do we have any Jedi masters? Oh, got some more ducks. Oh, excellent. We got people are coming in different places, but nobody's a newbie. So that's good to know. No one's a newbie at this. So we got the crew here that's ready to take their skills further. Very good. Okay, next slide. And at this point, I'm going to turn it over to Dr. Fleming, and she's going to take you through the rest of the slides here, and we'll have some more chats and some more interactive components as we move through.
Wado, Jamie, and colleagues at NCUIH. As was mentioned, our communities have been more and more involved with planning programs, and they've been over the years more and more involved with identifying not only what would be fundable, but also what they want to put forward as being really important. And sometimes the funding opportunities don't always match what the community is ready to run with and collect and really track over time. This particular slide is from the Policy Research Association, and it is a nice slide because it shows the primary areas of personhood and community-wide being: physical health, emotional health, social health, mental health, spiritual health, and environmental health. And under each of these different domains, there's some suggestions about some indicators, some that might be of interest to people. And it depends, of course, across communities, what communities are ready to pursue, or what work has been done in prevention and social media to get people attuned to issues and finding their voice and saying what's important from their point of view. So let's start with the physical health, and this is an opportunity for you to chat with us. So go to the chat, and if you were born in January or February, go to the chat and type in at least one indicator of physical health that you have heard from your community citizens that would be very important to address. And it could be increasing something or decreasing something. So Jamie might be talking now about what she sees coming in.
Yep, there's nothing yet in the chat. It could be things like increasing the number of fruits and vegetables people eat every day, decreasing diabetes rates, individual glucose levels. Those are great examples. Any others? Managing limited mobility. So that might be increasing mobility. Increasing access to traditional healing services. Yeah, very good. Decreasing diabetes, managing chronic problems. Very good. Great examples. Thanks, everyone.
Now, the people who are typing has a pool of that is somewhat limited because we've asked just the people who were born in January, February, so we can tell who to sing happy birthday to. So let's move to emotional health. And if you were born in March or April, type in an indicator of emotional health that is at the top of your Indigenous community's mind. There should be one or two people born in March or April, so don't be shy. I
think people are still thinking about it. This could be things like decreasing suicide is a common one that we hear. Decreasing depression or increasing hope for the future is something that we have a lot of communities measuring hope. Other ideas people have?
Anybody could jump in at this point.
Many of the clinics are measuring things like the patient health questionnaire, which measures depression and suicide. as well as the GAD, the generalized anxiety, anxiety disorder scale.
So you can hear from what Jamie shared is a range of different foci, but our communities are getting more and more involved with understanding the complexities of emotional health and increasing comfort levels in focusing on all many of those areas. What we're going to do now is just change it up a little bit and go to social health. And if you're born in May or June, just raise your hand, and then anybody can put in an indicator from your community around social health. And the examples there have to do with connectedness with a community, perhaps, is one of the up and coming areas.
Yeah, increasing community connectedness, cultural connectedness is also being measured a lot. I see Carrie shared increasing healthy boundaries and setting healthy boundaries as one of those areas of social health. Mm-hmm. Any other ideas? Participation in community activities. Sometimes that's another area that we measure, is that participation. If they're a lot of times we'll see people anchor those questions so that you can look if they're participating daily, weekly, monthly, or just a couple times a year, maybe. Participating in those healthy community activities or cultural activities in the community. And sense of belonging, connection, yeah, it's another really great one. The sense of belonging is so powerful, and it really is important as we think about connection to our community, knowing that we belong. Very good. Okay, Dr. Fleming, I think we've got a few
Let's move to the mental health arena, and it's different from the emotional health because it's more focused on belief systems about self, belief systems about others, beliefs, how we think about concepts like hope, and so and could be focused on self-esteem. So please join in the chat with your observations.
Yeah, I also appreciate this comment about lateral violence and working to decrease that lateral violence. That really does fit in the social health area. So I really appreciate, I wanted to comment on that one. And that concept of, as we start to learn about the historical trauma and the impacts of it for our own people, we do find sometimes that happens within our own communities. And what I've heard a lot of elders say, that's one of the areas in which it really slows us down as a whole to be able to work together and to make change together. And so addressing that lateral violence is really a critical part, I think, of the social health of our communities. So thanks for including that. And then also toxic shame came up in the chat. Yeah, and that's also linked to the historical and intergenerational trauma, that it just it's sometimes that shame is there for many generations, and it becomes to the point that maybe it interferes with our ability to have healthy relationships. So also really great ideas. I know in mental health, I also shared about the PHQ-9 and the GAD, some of those kind of behavioral health measures that people are using that would fit there in that category as well. Mm-hmm. Okay.
Thank you, Mark, for raising your hand. You must have a birthday in July and August. The next arena is very important in Native communities, and that is spiritual health. And that varies widely across our communities, and every perspective is as valuable as the next. We're tuning more into how spiritual pathways have both positive and negative effects on our people, depending on the historical perspective. So write in either something that you have heard people want to increase regarding spirituality, what you want decrease in that arena of spirituality. And put your hand up if you were born in September or October. I get to do that, hand up.
I also know this this aspect of spiritual health is so powerful, can be so powerful for people's healing and for their well-being and recovery, not only maintaining wellness, but also recovery when there's sickness or illness or other things that you might be dealing with. And the research is quite clear that spirituality does make a big impact and accounts for a lot of the change that you might see in a person. Victoria shared connecting with Indigenous values as immigrants. Yeah, that's really, I think, powerful, and thinking about how that unity that we have may be not just humans, but could also be two-leggeds, four-leggeds, winged ones, and having that connection with all things that move, all sacred things that move. And it's a little tough sometimes to measure spirituality because our communities are so diverse. And there is a tool that we have been utilizing for that. So we'll be happy to share that with you, that can be adaptable to different tribal communities, so that those things can have more relevance there locally. So.
Okay, we are ready to sing happy birthday to November and December folks. And we'll just sing it in our minds. But environmental health has been an arena that was originally one of the forefront areas of concern in the Indian Health Service. And then we gradually moved more into other preventative ways of thinking, but taking care of our environment so that it's a healthy place for living is what this arena is all about. So if you have Victoria, happy birthday. She's got her hand up, but it's and Anne, go ahead and write in an indicator, a data behavior or in circumstance that fits this environmental health arena. I know for our Diné people and Pueblo people, the whole uranium mining and other kinds of mining and ways of polluting the waterways in their homelands is one of the environmental issues there.
We oftentimes have folks looking at things like infant mortality rates, as well as could be fitting into the environmental health, and looking at what's going on with births and some of that kind of data we've seen. Any other ideas that folks have? Those November, December birthdays?
Well, you wonder why we've got this up to with all of these different aspects. And back in the day, it was a luxury just to focus on one area. But now we're becoming more and more aware and convinced that intersectionality, the big buzzword now, is where we should focus. A lot of these just fit together and have to be examined at the same time, which raises awareness of helping our community citizens identify just exactly more and more precisely how they think we want to work towards increasing something and decreasing something else. And many of these proposals want us to focus on integrating several of these arenas of health and healing. So thank you for your participation, and you are a blessing to the world no matter when you were born. And we will move on to the next slide. The words of having our information gathered and respected in a cultural way is what this next set of discussions is all about. It could be that culturally relevant data has already been gathered as part of clinical and prevention services. It could be found in program reports and existing databases. So we are getting more and more in tune with, as a group of people across the nations who are focusing on health and healing, to invite Indigenous perspectives, practice, and knowledge, and learning to hear from the people who consume these services, so to speak, and whether or not how they're satisfied, or how that particular focus fits their particular life ways and belief systems. The next slide is focused on secondary data sources. And as Jamie mentioned earlier, these are the sources that are outside of your particular agency or program, and they can be at the national level or regional level. So we're focusing on the national level, and there are federal agencies and other kinds of entities that have been doing some work more recently to actually say that there are Native people that they should be counting, and they should be asking questions of. So even though we still feel like an invisible group of people, that more and more of there's been pressure on these various groups that have to deal with population descriptions, population needs, population movements, and they're starting to actually put in attention to the Indigenous groups that we have. So the next slides are just quick snapshots, screenshots of well, no, before we move on, I see that. Why don't you folks write in the chat the national data sources that you have been using, or you've heard has been used in your organization or in any coalitions that are present in your communities. So in the chat, what national data sources would you like to point out?
So we have Census UIHI, the Urban Indian Health Institute, IHS SAMHSA, the Center for Disease Control and Prevention, CDC, ACHS. What is ACHS? Does anyone know? Carrie, could you tell us? Oh, American Community Health. Oh, okay. Yes, the American Community Health Survey. Yes, as a part of census. Okay, very good. And then county health data, Betty added their county health data being a useful source as well. Very good.
Okay, thank you. Next slide is focus on the Institute. And the next slide is a reminder that the census has gotten more complex as people can choose more than one identity, but it's also giving us a better sense of Indigenous groups as they're described in different ways through their census. The next slide shows the American Community Survey data, which is focused, linked to the census. And the next slide is about the Casey Family Foundation, or Casey family issue organization that has very faithfully been supporting kids count surveys and ways that we can identify the needs of our children. And you can go down into a state level in their database to uncover what might be applicable to your region. And then finally, I think we have the next slide is a very exciting development because of COVID, that we've got some new data gathering that's gone into the Johns Hopkins public health department there, that is helping us to almost instantly find out how our communities are faring with the impact of this pandemic, and shows how quickly, I think, if there is the will to focus on collecting information about our people, that it can be done. So I applaud the Johns Hopkins people. Next slide is taking a look at those same secondary data source possibilities, but at the local and regional level. And your counties and state agencies might feel like they're not helpful, but in some states, they're starting to come around in terms of identifying data and linking it with Native populations. Schools have data, behavioral health programs, family services, child welfare, juvenile justice. And then we are thankful for the very complex connectedness of the tribal epidemiology centers, which also have a regional and focus, but they can also provide down to your local scene, information down to your local scene. So again, like the last chat, please share, anyone, share what local data sources that you have found to be helpful.
I will also share, one that I've seen helpful that we don't have listed here is emergency rooms, and being able to get data from area emergency rooms related to things like suicide attempts or drug overdose or alcohol and alcohol related issues. So those are some things that we have seen. Office of Medical Examiner, I've heard that too, Carrie, that can be very useful, assuming that they're tracking it correctly. we have a lot of challenges sometimes with these related to how they're tracking our data. And so sometimes and yes, they aren't. And so sometimes where we have to start is when we learn that they're either not tracking for American Indian specifically, or they're not tracking correctly, that sometimes that's where we have to start, is advocating for them to do so. Mm-hmm. And we've seen people be very, with states and counties, be effective in getting them to advocate for why this data should be collected. Another area that we sometimes hear is that, we can't share this data with you, and they may cite HIPAA or FERPA or some other law that says they can't share. But the reality is that in aggregate, de-identified, yes, they can share. And so sometimes getting memorandums of agreements or other things could be really useful for allowing that to happen. I think Victoria has her hand up. Is that right? I can't see. Hi, Victoria. You've got your hand up. Oh, it's not my hand. Okay, no problem. Somebody else's hand. The avatar.
Well, it's
so
we're still in the Halloween mode, I guess.
Yeah. So do folks have other examples, any other types of places that you have found data. A lot of times the Boys and Girls Clubs may have data, area Boys and Girls Clubs or other types of community service agencies. TANF sometimes will have
WIC.
data. WIC, yeah. Mhm.
And it's, as Jamie mentioned, it's really important to knock on the door. And we may not see the fruit of asking for information that is this specific, but there is a breakthrough for some communities. So please keep the pressure on in a respectful way. And one of the messages is that they're helping you, but you're also helping them. And so finding common ground for data that's important to both parties is often a key to moving this kind of partnership along, so that we can trust each other better, and find also some other unusual workforce possibilities. We have heard people using Native students in academia, in college or university, could be at any level really. And if you attend to the appropriate confidentiality issues, an intern could really be helpful to pull out the data that staff does not have the time to do so. So we are giving you some ideas about how rich the field is around us, but it does mean some collaboration and some joint goal making. Next slide is a beautiful picture of our tribal epidemiologic centers, and it's great that they work together too across. So there's a bigger and bigger picture of our communities. Okay, at this time we have a poll, so we're switching it up from emojis, and we want to think about the fact that programs like yours have been providing information to the Indian Health Service in particular about the services, about the clientele that you serve. So how successful has your program been in obtaining useful reports back from the Indian Health Service? Are those reports, how successful have you been in getting reports that summarize your own specific data? One is a not successful to all the way to number 5, which shows that you've been able to accomplish this. So click on one of their choices, 1 to 5, hit the submit button, and then we'll have somebody share how you all vote. Nicole, it will give us a minute to, oh, magic. So it seems like it's leaning down to the bottom of the scale in terms of 70% loading up for not successful or a little successful. So we do have some work to do, but there's been some breakthroughs, and so that's important to celebrate. Okay, thank you. Next question, next slide will then focus on primary data. Jamie mentioned it. It's data that you have right at your fingertips, right in within your agency's files, your organization's databases. Again, one of the ways it can be very helpful, especially for the needs sections of your proposals. It has to do with your past history and the need for learning about, knowing about your community and the need for services, and accessing data. There are some ways to describe that for the possible funder. And again, there's a staff issue in terms of not everybody having the person power to have people focus in, take the time to organize, pull that data out and organize it. But Jamie's going to share an example of the usefulness of keeping an eye on the primary data that's around you.
Yeah, so there's a lot of different examples that you could use, but we just provided one here just around certified peer counselors, and we've been seeing more and more focus on certified peer counselors in the field, just because the workforce shortage, particularly in behavioral health, is really substantial. And after COVID, it's even gotten worse. And so a lot of communities are focusing in on certifying peer counselors to help fill some of that gap and to be that community-based resource. So I just provided that example. And you can see that sometimes it's hard to get unduplicated numbers, which is the number of people served, but it is important if you could really focus in on being able to separate out duplicated from non-duplicated. It does get a little complex sometimes in our EHR systems to do that, and I recognize there's sometimes some challenges around that, but this gives an example of how you might be able to showcase that in a, let's say, in a proposal. And the next slide is another example. This is an example related to like using maybe some of your needs or issues, looking at needs or issues. So you could even do things like look at various diagnoses and even combine those diagnoses with their ICD-9 codes to kind of look at what's the impact in your clinic population on these things. And, one of the things that we have been noticing with some real data is that we've started to see the number of positive screenings from the PHQ-9s and the GADs have really gone up significantly over the course of the pandemic. And so we've started seeing those kind of trends and tracking some of those kinds of trends. So any of that kind of stuff could be really helpful for your proposal. Next slide. And then Candace, I'll turn this back to you.
Yeah, thank you. Let's say you're at the point where you have obtained data, whether it's at the national level or regional or local or within your clinic, within your program. The important next step is to organize it and be able to present it to possible funders in a way that catches their eye and makes it really clear what message you're sending about a need or about a resiliency factor or about a workforce capacity issue. And of course, our communities are not well, I guess, highest technology levels do not have these high levels. But we found that the Excel and other spreadsheet applications can be extremely helpful to help you to organize data that comes from literature reviews, that comes from your different sources, and you can calculate basics and advanced statistics just because you have inputted the data in an Excel sheet. And there's other ways to organize. There are specialized applications and calculators. We've seen the word cloud application used a lot because once you've completed it, what jumps out are very important messages to that come in through your visual channel, and the reader, the reviewer of your proposal would be able to have see what's been an impact message forward. And online calculators can take numbers and be able to help you present them in graph form or charts or other ways to bring forward what the numbers are telling you, what story they're telling you. Jamie, do you have anything else to add about this?
Yeah, I would just say that those word clouds, there's some free platforms and they really do help to, like, a lot of the data that we have that is meaningful is the word data, the qualitative data. And I find those word clouds to be really helpful just to help people kind of see it in a snapshot. And especially when our our samples are often small. And because we have small sample size, a lot of times that we actually get more out of qualitative data. So when we're thinking about data, remember that qualitative stuff can be very powerful, particularly when you could find ways to package it and present it in a clear and short form, because a lot of times you have page limits on your applications and other things.
Next slide, please. And this is the point when we understand that people have been walking down this road and using data, and we invite your generosity and your desire to share across programs, across cities, across tribes, and to share what the tools and resources that you have found helpful in this whole important process of gathering information. So if you want to put into the chat, we will start to identify from your experience and your generous spirit something to share across all these attendees. And I think we'll be able to spread it further than that as well.
I started sharing, and I'll continue to keep adding here to the chat the things that I could share. One of them is the cultural connectedness scale, which was normed with a number of communities, urban Indian health organizations in California, and it's published there. So the first link on PsycNet will take you to those references. That's a really cool tool because it's got an examples list that you can adapt to your local community. So there's different categories that you can adapt related to the words and the phrases and the concepts that are being used locally. And the cultural connectedness tool actually has 3 subscales. It measures spirituality, traditions, participating traditions, and identity. All really important protective factors. So those are some local tools that folks are using. And then the second one I linked to is the Hearth Hope Index. And we really like that tool because it's simple. It's used with, we've used it with teens as well as adults. It's been normed. It's got great psychometric properties, and it has been adapted. It's been used really well in our tribal and urban communities. And we like it because it measures hope for the future instead of hopelessness. Sometimes it's hard for us to find measures that are positive and strength-based. And so that one we've actually been able to use quite a bit, and it's really relevant. If you can raise someone's hope for the future, wow, that's an important outcome. Mm-hmm. So those are a couple resources there I'll share, but I'll keep adding more, and maybe some of you have ideas or things you'd like to share as well.
We will have to move on, but yes, do keep sharing in the chat format, and we will say thank you for your respectful attention to what we share and how we have brought information from communities just like yours and share them across in this particular way. Back to you, Siebel.
Thank you for that, Dr. Flemings. And I think there is some space just for Q&A, and also if folks, participants in today's call would like to share some tools that have been beneficial for your organization in, as Jamie mentioned, being able to collect data to help with funding or applying for grant proposals. I think it's important, but we wanted to give a few minutes just to ask if there's any questions for our presenters today before we move on to our closing out today's session. And Carrie provided the White-Beck scale and social determinants of health. Thank you, Carrie, for that. I think that those are helpful tools. Jamie, I don't know if you wanted to add, and I think you might have added another one in there.
Yeah,
Also.
the strength needs and cultural discovery tool is another, it's qualitative, but it's a really great tool that folks are using. Thanks, Carrie, for that. The Whitbeck scales, I think it's called the historical trauma, the historical loss scale. We'll try to get those links out to you all so that you can access that. That's another good one. It basically, before Whitbeck's work, I would say that historical trauma was really a theory that we all knew wasn't really a theory, and Les Whitbeck was the first one that, from my perspective, that really started to show that indeed historical trauma exists, and because he was able to measure it. So those tools we have seen used. We've also seen some using ACEs, although years ago there was someone who tried to do a more like a resiliency form of that, and I've had a hard time finding it since. But if anybody knows about the ACEs resiliency tool, but it tries to get it kind of like, okay, now you've had all these adverse childhood experiences. Now what is the opposite of that, or what does the resiliency part look like? So those could be very useful as well.
I would also like to add that we're paying attention to organizational health also. And so we do focus on individuals, different age groups, couples, families, peer groups, but we also live within and work within organizations, and thinking about how to make those healthier is really another wonderful up and coming focus.
Yeah, I thank you so much, Dr. Flemings and Jamie. These are, and our participants. We will make sure to in a email sent out to you after today's session, have all of these links to for y'all all to have as resources, as well as the PowerPoint presentations. I want to thank y'all for joining, and there was a link to our survey that for today's session that was provided in a chat box. You could also just use your iPhones if you'd like, or smartphones, to capture the QR code and just fill out the survey. Your survey is very helpful to us in how we could better improve these sessions for you and bring amazing presenters like Dr. Flemings and Dr. Barges to share and provide more resources for all of you. Our next, I also want to share some upcoming events. Again, as I mentioned, session 3 of this 3-part session on strategic planning for community advisory boards by one of our urban Indian programs in San Diego are going to be the lead presenters on that. So keep an eye out for that, and also just register today. So 2 weeks from now, it's going to be another amazing session. And obviously our November 17th session on messengers in health with the focus of vaccination, flu, pneumonia, and COVID-19 vaccine best practices will be also happening. So please register for that also. Outside of that, I wanted to just thank you all again. We really appreciate your time. Everything that y'all have done today is much appreciated, and we want to thank our presenters again, and we look forward to seeing all of you on November the 16th in 2 weeks.
Thank you, everyone.
Thank you. Have a good day, everyone.
Thank you, Widow.